everybody, it's Nurse Vonna here, and as promised, I'm going to do a video on some nursing subjects that students were saying that they had difficulty studying. So the two subjects I decided to cover was pathophysiology and pharmacology. The reason why I chose these subjects is because they're more towards the beginning of nursing school, and I noticed most of my students were struggling towards the beginning, and there were some students struggling in the middle too, but I'm going to cover those next. So I'm just going to see which classes the upper level nursing students want me to cover. But as for now, I'm going to start with my baby nurses. So this is just an intro video because the videos that I have going over how I study are very non-traditional. I'm not going to be verbatim showing you with my body present. I decided to do a voiceover with some notes that I took in my little sparkly notebook. I've had this notebook since the beginning of nursing school. Trust me, you're going to need a notebook with all the notes you're going to take in orientation, on the floor, etc. But you guys haven't crossed that bridge yet, but my goal is to get you there. And once you get there, then we both lost. I'm just kidding. Okay, so disclaimer, I am 8 months pregnant, so if I get out of breath a little bit, I'm sorry. I'm tired and this baby is kicking me out of control right now, but I'm trying not to show it. So I'm just going to give some quick general tips right now, and then I'm going to start with the first video. The first one would be pathophysiology, and then there'll be a part 2 with the ending with pharmacology. So some general tips. Professors are very, very important in nursing school. I've had bad ones, I've had great ones. It's best that you communicate and have a good relationship with your professor. They might not be the nicest person ever, but you have to create some type of form of communication with them to get out of that class. If you do have a bad professor and you've spoken to that professor and let them know that the way that they're teaching isn't helping you in your journey through nursing school, it's best to go through leadership or just try to tackle it with some friends and just say, hey, let's just get out of here because this lady is crazy. I've had teachers like that, but mostly I utilize my leadership, and leadership literally, they listen to you, and most of the time that issue is fixed. Another thing with professors, they have all the resources you need in order to be successful in a class. So it's important to ask for study guides before an exam. PowerPoints are very important. The way I take my notes, I need PowerPoints. I honestly don't know how I survived nursing school without some type of PowerPoint. Some teachers don't like PowerPoints. They say just read the book. I hate reading, so just give me something that's straight to the point. I use my book simply for pictures, definitions, etc. I use my PowerPoints to take notes while I'm in class, and I use those notes to make the notes that I will show you in those videos that's coming up. What else? Reading. So if you are a reader, it's best to be an active reader. I know I'm saying a lot, I'm sorry. I don't like reading, but I did have friends that did read, and they were A+ students. Some of them were average students. It all comes down to how do you read. If you read a whole subject and you don't know what you just read, you're not reading actively. The only way I can read is if I take notes while I read. So after you finish a paragraph, if you are able to write down 3 points about what you just read, then you have grasped that concept and you can move on to the next paragraph. That's the only way I can see that you are actively reading. That's the only way that you'll grasp the information. It's best to bring your book to class, and whatever subjects that the teacher covers, star those subjects. Those are the subjects that I will focus on in my reading, because I guarantee whatever they focus on will be on that exam. What else? Study groups. Yes, study groups are very important. If you want to be successful and you're by yourself and your grades are slipping, obviously you need some help. I'm just saying. I was by myself. I was solo dolo. Towards the beginning of nursing school, I didn't have a study group. It was just me. I was doing just fine. Had 3.9 GPA, all A's, 1 A-. And then I got to health assessment and fundamentals, and my grades just totally flopped. I was like, what am I doing wrong? I don't know what's going on. It was the way I was studying. And once I got in the study group, all that changed. My 3.9 dropped down to a 3.1 or something. I don't know. It dropped down. Didn't fail the course. I have never failed a course in nursing school, but I did get a C+. C+ was really a B, but the way my school grades is stupid. All my grades are a B in my head, but at my school it was a C+. So I took them C+. But once I got in the study group, my grades skyrocketed up. My 3.1 was beautifully lifted. I got into Sigma. It just was a whole 360. And the reason why I say study groups are helpful, everyone knows something different. Don't be in a study group where everyone is lost. Then you defeated the purpose of a study group. Most of the people in my study group was either A+ students, AB students, or average students like I was. And the average student usually rises up to the A+ student because you all learning the same information and they're able to teach you. Some subjects I was able to teach because I was stronger in those. Since we're in a pandemic, no, most people are not on campus, but I'm sorry, that is not an excuse. We have Zoom, we have FaceTime. Make some friends, y'all, I'm telling you. And the friends that I made in nursing school are like lifelong friends, and you're gonna need them later, especially when you're trying to dip in different specialties, because I have friends in every specialty. So when I need that reference, you got a friend in them or me. Just saying. Lastly, the most important general tip is every class is different. You cannot study for one class the same way you would study for another class. Some classes that I use these notes, it was consistent throughout. Like the way I studied for Patho, I use the same kind of studying for med surg because it's really the same. They just add drugs and they just add diagnostic testing. You'll see once you see my notes. Trust me, use this format that I'm going to present and I guarantee you will pass this class. Everything I do is repetitive. I'm a repetitive learner, and that's how I survived through nursing school. So yeah, that's the general tips that I have. I'm going to get started with the first video, which will be pathophysiology, and the very next day I will post pharmacology. After the pharmacology video, I will make another post asking for what the other subject do people want me to cover. Given that I am pregnant, it might take a little while. Like this one took a little while because I made the videos a while ago, but I got real sick and just was out of it. So I try to make them as soon as people tell me what they want me to do. I kind of write it down and then I film it later. So yeah, I'm gonna shut up now because I'm talking too much and I'm annoying myself. All right, so the first video is coming right up. Stay tuned. Okay, so I decided to start with pathophysiology, seeing as I have a lot of new nursing students. So they are taking the beginning courses of nursing, and that includes pathophysiology. So with pathophysiology, it's important to know what it is and what is the actual goal in nursing when it comes to the pathophysiology. So patho is abnormal change in the body due to a disease or injury. So this is the main goal, critical thinking. I think this class is the first class where I had to get my critical thinking skills started. I wouldn't say I had to really use them because in this class I used mostly games and memorization still, like as if it was anatomy. But there was some critical thinking involved, but not much. So let's move on. So my study tips. First, flashcards. And it's important that you make your own flashcards. It's important to do it by system and the related diseases associated with that system. So if you're doing the cardiac system, first you'll go over what the cardiac system is, what is all involved in the cardiac system, and then you'll go with what diseases that can come from the cardiac system, like heart failure, some injuries, some processes like angina, heart attack, stuff like that, etc. So they'll be all in one set of flashcards. And make sure you use those flashcards with definitions as well. I noticed that if you do not know the definitions, it'll be hard to understand the question, and it'll be hard to understand what exactly is asking you to do. So tip number 1 for Patho is flashcards, and make your own. Don't try to use someone else's. The key to making your own is it helps you study, and you subconsciously remembering this information because you're writing it down. And the more repetition, the more you'll be able to remember it. Study tip number 2, formatted note taking. So me, I love pens. I find that using different color pens is helpful. It helps you put everything in different categories. Format by importance. When I say format by importance, it's when the teacher is speaking, he or she emphasizes what they're looking for in that system. So it's important that you don't overload yourself with a bunch of information that's not even necessary. So when you format by importance, it gives you the direct information that you need for that subject, and it helps a ton. Don't worry, I will explain deeper later. Lastly, knowing what's important. That ties into formatting by importance. So by knowing what's important, usually the teacher repeats it, or if they have, like I said in the beginning, asking for PowerPoints, asking for a guide, so you can know what's important. So study tip number 2, formatted note taking. Study tip number 3, quiz yourself, people. Quiz yourself. After every section, quiz yourself over the material. Don't move to the respiratory system if you're still struggling with the cardiac system. So I never move on to the next system until I at least get a 90 or 80% on the practice exam. And at that point, I realize I know enough to move on to the next item. So practice questions, very important. After every section, do practice questions. I would invest in a question bank app. The one that I use is NclexRNMastery, but I noticed that on NclexRNMastery, they do not have pathophysiology on it. So I Googled and I found that study.com, proprofs.com has questions about pathophysiology. And this book, Pathophysiology Text Bank, author Catherine L. McCants, is about $14. It's on sale right now. I'm going to place a photo of the book here. And I'll also post a link to that book and any other sources that I find that can help with practice questions. Also flashcards. You can use matching. I'm not sure how I use matching in this course, but I think I did it by disease process. So like if you're doing the respiratory system, I'll have different characteristics of different respiratory diseases, asthma, cystic fibrosis, what else? Any other respiratory disease that can occur. I'll have descriptions of those, and I'll write them on different flashcards, and then I'll match them up to make sure I know exactly what that disease process is. And usually that helps. All right, so this is my example. Hopefully you can understand my writing. I'm going to go over each section and describe it. So this is what I mean by formatted notes. And this is cardiovascular system. I chose to do myocardial infarction. This would be under the cardiac system. So when I say formatted notes, this is how my notes look usually on everything in this class. I take traditional notes sometimes in class while the teacher is speaking, and I take from my traditional notes in PowerPoints, and then I format it in this format. I find that it focuses on the main parts of each subject or section that you need to cover. So the first section will be what it is. The second will be the cause, 3 risk factors, 4 symptoms, 5 nursing actions. So with the example myocardial infarction, what is it? So define what MI is. It's a heart attack or the blockage of blood flow to the heart muscle. Causes, underlying causes of a MI. Blockage in the coronary artery due to the formation of a clot. See, simple as that. It's straight to the point. All that extra jargon that they try to say, this is suffice enough. It tells you exactly what it is. It tells you exactly what causes it. Straight to the point. And then risk factors. So usually most of the questions can come from this area, so I just bullet point them. So smoking, male, older age, high blood pressure, cholesterol, obesity, etc. Just the major risk factors. And then you go here to symptoms. So you write key symptoms presented by patients. An example, tightness in the chest, pain in the neck, left arm, etc. Stuff that's specific, like left arm. You see how I put lines under it? I probably highlight that as well, because I guarantee you it will be a question pertaining to a patient coming in complaining of pain in the left arm, has some diaphoresis and etc. Automatically you're going to think he's probably having an MI, most likely. Major key things. So in each section there's always something that's major, something that is unique to this disease process, and atypical symptoms in women. And as we know, in MI, women can present with different signs and symptoms. So it's important that you highlight that and you put that in your symptoms. I would underline it, highlight it, bubble it, because I guarantee you it will be a question about it. Okay, next, subjective versus objective signs and symptoms. And they hounded on this a lot in the beginning of nursing school. And over time, it just becomes natural that you separate them mentally. And this also helps with the nursing assessment. So as you assess the patient, they're going to be talking to you, and you're going to look at their subjective symptoms and their objective symptoms. And you can use this into applying your ADPI. Okay, 5. Now, to me, this is the most important, nursing actions. So, nursing procedure in the event of an MI or any process. So this is, what does the nurse do in this particular event? So, like I said, majority of the questions comes from this section. So this includes like intervention, possible tests, labs that you would get. I didn't go into depth on this because I'm not sure in Patho if we covered medications or not, but I know we went over possible tests that you would test in labs that they would do or something. I know we did labs, etc., EKGs, STEMI, non-STEMI, etc., but you're not there yet. So this is just Patho, but this is how I format my notes in pathophysiology. Hopefully you get a good look, take a screenshot if you need to. But I would use this for every system. Most importantly, the disease process. It's thundering outside, so yeah, pretty scary. So this is how I study for pathophysiology. If you have any questions, or if you need me to go further in depth on a certain subject, like literally write down what I would write for that subject, or for that disease process, let me know. Thanks for watching.